Today we've got something a little extra that we want to roll out as part of our overall agenda to restore Oklahoma. We are at the end of the 9th week of the legislative session, and with only 7 weeks left to go, we've still not seen any significant revenue-raising measures to help balance Oklahoma's $900 million budget hole on the floor of the House of Representatives. Our caucus weeks ago offered up our Restoring Oklahoma plan that offered $1.4 billion worth of potential revenues, put together in a package that considered Republican ideas and Democratic ideas and ideas that just hopefully would help the state of Oklahoma, help our public school children, help our senior citizens in nursing homes, help our hospitals, help those people who work in our public safety systems. But unfortunately, the Republicans have done nothing since we've rolled out that budget. And now today, for the 3rd week in a row, the House Republicans are putting on their dog and pony show, bringing all the subcommittee on appropriations together to simply apparently allow for House Republican members to insult agency heads, because for the last 3 weeks, as agency directors have come in and laid out the budget cuts that they've sustained over the last 6 years, and then laid out what an additional 14.5% budget cut would look like to them at the request of the House Appropriations Chairwoman Leslie Osborne, what those House Republicans have done, instead of realizing how disastrous these budget cuts have been, these tax cuts, these tax credits, these gross production tax cuts have been to core services. Instead of trusting those agency heads, instead, they've essentially called those agency heads a liar. They said, no, you're just giving us a Chicken Little scenario. The things aren't really as bad as you say they are. But the facts are what the facts are. When you've got schools down to 4-day school weeks, when you've got 2,000 fewer teachers in the system, when you've got DHS and the Pinnacle Plan in danger of being taken over by the federal government, when you have our public safety system busting at the seams with not enough employees to take care of those people in the prison system, the reality has set in for the state, it's set in for our citizens, it's set in for our caucus, but it hasn't set in for House Republicans. And so we're calling on them to address our budget shortfall. Do something serious, bring real revenues to the table, and do it soon, because we've only got 7 weeks left to try to make a difference in the lives of the citizens in the state of Oklahoma. But we understand, those of us in my caucus understand, that it's not just a budget issue. It's not just finding more money for roads and bridges. It's not just finding more money for health care. If we found $900 million today, if we found $900 million today to be able to fill up this budget hole, you still have 4-day school weeks. You still have 2,000 fewer teachers. That's no new money to hire any new teachers or to extend the school week out by another day. And in particular, as it pertains to health care in Oklahoma, that $900 million would do nothing to stop what we've seen over the last 6 years in terms of health care in the state of Oklahoma. It is unquestionably a health care crisis in the state of Oklahoma. And today, our caucus wants to address that crisis. As we currently speak today, there are 1 in 6 of our state citizens who are uninsured in Oklahoma. To put a face on that, that makes 655,000 citizens, about 90,000 young people, have no health insurance in the state of Oklahoma, and that makes roughly 565,000 adults with no health insurance in Oklahoma. When the leading cause of bankruptcy in the country and in the state of Oklahoma is medical bills, every one of these citizens that go by without having health insurance makes it that much more likely that their financial situation could be in ruins if one of them or one of the members of their family gets sick. Each and every year, because of those 655,000 uninsured Oklahomans, our state hospitals give away nearly $600 million in uncompensated care, in free care. They give it away. They're mandated to do that by the federal government. And the state of Oklahoma should take our responsibility seriously and find a way to reduce the uninsured and thus the uncompensated care being given away in Oklahoma. But what are the ramifications of that uncompensated care? In the last 6 years, 9 hospitals have filed for bankruptcy in Oklahoma. In places like Atoka, Drumright, Fairfax, Pauls Valley, Prague, Pushmataha, Sealing, Stigler, and Veneta. They've all filed for bankruptcy, making access to health care in those parts of rural Oklahoma much harder to receive. And including those 9 hospitals that have filed for bankruptcy, 3 have closed. The hospitals in Eufaula, Frederick, and Sayre no longer provide the services that they once did for those citizens in the state. That's all because of our uninsured rate, the uncompensated care rate, and the lack of leadership by the governor and the Republicans in the House of Representatives. As we rolled out our Restore Oklahoma plan just a few weeks ago, we found ways, whether it was raising gross production taxes, reversing the high income tax cuts, and additional sources in the cigarette tax, to raise nearly $1.4 billion. The important part of our plan today, not only are we able to raise $1.4 billion by reversing some of those fiscally irresponsible cuts, but today our plan, in calling for Governor Fallin's Insure Oklahoma plan, by expanding Insure Oklahoma, we could bring in nearly $900 million more to help balance our budget, to help provide health care access to the citizens in the state of Oklahoma. As you see before you today, if we expand Insure Oklahoma as Governor Fallin called us to do just last year, not putting one new person on Medicaid, but bringing down our federal dollars, just as the state of Kansas has tried to do just in the last week. If we do that, we're talking over $2.2 billion that could be infused into the state's budget, into health care, public safety, public education, that would go a long way in restoring Oklahoma's future. To put a point on it, the Insure Oklahoma expansion, Governor Fallin's plan, bringing $900 million in funding for health care and mental health, covering nearly 175,000 additional Oklahomans with insurance, and doing it all without putting one new person on the Medicaid rolls in the state of Oklahoma. Governor Fallin was right to push that plan last year. We endorsed it and supported it last year, and we endorse it and support it again this year. And we're calling on the governor to stand up and join our colleagues in the state of Kansas and ask the Speaker of the House and the Pro Tem of the Senate to put her Insure Oklahoma plan on the floor of the House and on the floor of the Senate. We are confident that the votes are there to pass both, and we're confident that if they got to the governor's desk, unlike Governor Brown back in Kansas, we believe the governor would sign it. We waited. It should be important to note, we waited to roll out this portion of our Restoring Oklahoma plan until today, because we heard that the President of the United States had intent to gut, repeal, and replace the Affordable Care Act. The Republicans in Washington tried to do that and failed in spectacular fashion. They've even kicked around the idea of trying to do it again, and they've left for their recess just today, their 2-week recess, without making any progress on repealing and replacing the Affordable Care Act. It appears to us that what President Trump said a few weeks ago will continue to be the case. He said that the Affordable Care Act will be the law of the land for the foreseeable future. And if that's the case, then it is incumbent upon us as leaders, not as Democrats or Republicans, but as leaders, to reach out across the aisle and bring our federal dollars home, like our neighboring states like Arkansas have done, to cover those folks who don't have any health insurance and to improve the lives of all of our citizens in the state of Oklahoma. So with the Insure Oklahoma expansion plan and the Restoring Oklahoma plan together, nearly $2.3 billion could be brought into the state to take care of the needy and the most vulnerable in our state. And we're asking the governor to step up, join us in our call, asking the House and Senate Republicans to do the right thing and expand Insure Oklahoma. It's important to note that this doesn't put one new person on the Medicaid rolls. The Medicaid rolls are fundamentally different than the Insure Oklahoma plan. If we put these folks on the Insure Oklahoma plan, they would have co-pays and responsibilities that current Medicaid recipients don't have. There's greater personal accountability and responsibility that comes with the Insure Oklahoma plan than if you just put people on Medicaid. The $900 million that would be brought in to help stabilize reimbursement rates, to help stabilize hospitals in Oklahoma, would far outweigh the $30 to $60 million it would take on the state side to meet our state match requirement. And our caucus has said last year, and we're saying it again this year, the members of our caucus are willing to vote in lockstep to support a cigarette tax increase if it's used to fund the Insure Oklahoma plan, bringing in $160 to $180 million from the cigarette tax and $900 million from the Insure Oklahoma plan, gives the state over $1 billion for health care in Oklahoma, which would go a long way to ensure that the Health Care Authority and the Health Department are funded appropriately. Even if changes are made to the Affordable Care Act, there is a high likelihood that those states who were responsible to their citizens, who expanded Medicaid or expanded their version of Insure Oklahoma, those states would be rewarded for that under the new health care plan. Moderates in the Republican caucus in Washington, part of the reason the Affordable Care Act repeal and replace failed was because moderates from places like Arkansas and Indiana and other places who desperately knew pushing hundreds of thousands of their citizens off of Medicaid and into the rolls of the uninsured was not a smart plan. Moderates protected Medicaid expansion in the Republican caucus in Washington. We think they'll protect it in whatever plan they bring forward, and it is high time our state join the 31 other states in the country who have expanded Medicaid and do the same. Our caucus for the last number of years has called for an increase in the gross production taxes. We believe that is one of the largest contributors to our budget woes over the last 6 to 8 years was the most generous gross production tax cuts of any major oil and gas producing state in the nation, costing the state hundreds of millions of dollars a year. Each and every year for the last 4 or 5 years, our caucus has been the only voice in the wilderness calling for an increase in the gross production tax. This year, we have been joined by other members of the oil and gas community. We appreciate former Mayor of Tulsa, Dewey Bartlett, and other oil and gas interest in Tulsa calling for an increase in the gross production tax from 2 to 7%. We don't believe that the gross production tax going from 2 to 5 or 2 to 7% would detrimentally affect the oil and gas industry in the state of Oklahoma. Those same industries, those same companies who have large buildings in downtown Tulsa and downtown Oklahoma City are drilling in Oklahoma paying 2%. They're drilling in North Dakota at the same time paying 11%. The gross production tax doesn't affect their bottom line, but it affects the bottom line of our children in our public schools. It affects the bottom line of those who are trying to keep hospitals open in rural Oklahoma. And we are grateful to people like Mayor Bartlett and others in the oil and gas industry who recognize that and are willing to put the weight of their opinion and their reputation behind increasing the gross production tax to improve the state of Oklahoma. I fundamentally believe that if a gross production tax increase was put on the floor of the House of Representatives today to go from 2 to 5%, maybe even 2 to 7%, that there are at least 51 votes in the House of Representatives to get that done. Our caucus believes that as long as the 7% rate stays where it is, the 2% rate is an exemption for 3 years, just like it was a 1% exemption. When they went from 1 to 2% a few years ago, they did that by still keeping the overall rate at 7%, and they were able to get around the 76 vote threshold that's required under State Question 640. We believe that going from 2 to 5% or even 2 back up to 7% would only require 51 votes in the same way that the last gross production tax adjustment did.